Hi guys, my name's Bridget. I'm one of the exercise physiologists at Vector Health. Today we're going to be talking about blood pressure and the different ranges that are safe when we're looking at exercise. So the information given in this video is very general blanket advice. There are guidelines in which you should follow, but it's different case by case, and you should always definitely consult a professional to talk to them about your specific medical history, your specific observations, and what's going to be right for you. So absolute perfect textbook reading of blood pressure is 120 systolic with 80 of diastolic. Systolic and diastolic blood pressures, you'll see you normally get a blood pressure that's written as a fraction, with the top number being your systolic and your bottom number being your diastolic. The reason why it's written like that is your systolic blood pressure is the greatest amount of pressure. So as the blood comes out of the heart, it forces or exerts a force against the walls of the veins, and it's the greatest amount of pressure that blood exerts against those veins. So that's when your heart's completely contracting, really squeezing all that blood out. It's pushing that blood out really as violently as possible. It's trying to get it out as quickly as possible. And then when that heart completely relaxes and it's not trying to push any blood out at all, it's the pressure then, the bottom number is that pressure when your heart's relaxed, and it's the minimal pressure that the blood traveling through exerts on those walls. So that's why it's written like a fraction. You've got your greatest number written over by your bottom number, and as I said just previously, textbook for that is 120 over 80. Not many people come in with 120 on 80. People are all over the shop, and especially that top number 120 can be really influenced by different things. Even just me sitting here talking, especially because I'm talking in front of a camera, which does make me a little bit nervous. You'd probably, if you took my blood pressure right now, my top number would probably be a little bit higher than normal. It can be influenced by talking, it can be influenced by getting in and out of a chair, by the amount of activity you've done over the past couple of days. Driving into work, people's blood pressures tend to go up when it's raining, because everyone knows that people can't drive when it's raining. And then even with temperature changes as well, we've just seen that this week with the shift from really hot humid weathers and the pressure changes in the air coming into the nice cooler, more dense pressures, we're seeing a change in blood pressure just slightly. So that can be cause people to be symptomatic. It can not affect some people. That's why I said it's always best to consult a professional in terms of what your specific experience is and what you need to follow. In terms of safe ranges to exercise, the top number we try and keep between 120 and 180. Normally if it's for some reason above 160, we do sometimes ask a couple of questions, the reason being that when we first start exercising, as we're doing the exercises, our blood pressure does increase. So if we start it with an already very high number, and then we go and further increase it, we put you at risk of a stroke or a heart attack, which we definitely don't want to do. So making sure that we are in a safe range before we start exercising means that with the increase, we're still going to keep you safe. The bottom number, as I said, the textbook is 80, so we try and keep it between 80 and 90 before starting exercise. The other thing that we'll probably look at when we take your blood pressure is your pulse rate. Your pulse rate and your blood pressure work really well together to balance what we call cardiac output. So cardiac output is the amount of blood that your heart ejects every minute, so it's normally a litres per minute number, with blood pressure being the amount of blood that's ejected for each contraction. And then the beats being the number of time that contracts within the minute, the two of those add up to equal cardiac output. So the total volume per beat times the number of beats equals the cardiac output per minute. And they are always wanting to be in balance. Say for example, you're really dehydrated, you don't have a lot of fluid within your body, the amount of volume of blood within your body is going to be less, which means that to keep the same cardiac output, it's kind of like a scale. To keep things here, if you've got lower volume, you're going to have to increase the amount of beats per minute to be able to keep everything nice and stable. So when we take your blood pressure, we quite often also look at your heart, because that can tell us a lot of other things that's going on within your cardiac system, especially if you're symptomatic, you're dizzy, you're headachy, anything like that. Could point to signs of dehydration, could point to signs of other things going on, which is why we always take both. The textbook for that is between 60 and 100 beats per minute. It is, again, pretty normal for people to be outside of those ranges. I've definitely seen it quite often in this clinic. I'm sure most other professionals have seen that. Yeah, not all of us are textbooks. We're not designed to be textbooks. So although that's the normal ranges, it's definitely not what always happens. And please don't be alarmed if you take your blood pressure, your pulse rate one time, and it's outside of those norms. If it's a once-off reading, it's probably just a normal result of the human experience. All right, thank you guys for listening in. Hopefully that answers some of your questions, and I'll see you guys around the gym.